Tonight, learn about the cardiac team at Penn State Health, Heart and Vascular, and meet a man who has given a new lease on life from the care provided by that team. Plus, find out how you can prevent heart disease and have your questions answered in a live web chat with a cardiac specialist, all on Heart to Heart, an abc27 special presentation, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. February is American Heart Month, a time to focus on our cardiovascular health. And there's a reason why. Heart disease is the leading cause of death for men and women in the United States. Statistics show every 40 seconds someone has a heart attack. Family history of heart disease does play a role in your heart health. Tonight, Penn State Health doctors will answer some very important questions like, what are the signs and symptoms of a heart attack? When should a heart transplant be considered? And how can you improve your heart health? And if you have questions at home, Denise McCracken is here to tell you how to get them answered. Hi, Denise.
Hi, Deborah. Yes, with us tonight is registered nurse Isley Guzman. She is the Atrial Fibrillation Coordinator at Penn State Health Holy Spirit and Hampton Medical Center. She'll be answering questions until 8 o'clock through our live web chat. If you at home have a question, feel free to submit that at abc27.com/heartchat, and we'll be back later in the show to share some of those with you. Deborah.
And thank you, Denise. A State College man knew the meaning of the two words heart defects at a very early age. As a teen, Doug Garbin met the team of cardiovascular specialists at Penn State Health Heart and Vascular, and they saved his life. Here's Doug's journey.
Not many people can say they had their lives saved. I have. Multiple times. From the moment I was born, my heart was cause for concern. I had a rare heart defect that made my smaller chamber do the work of my larger chamber. As a kid, I got tired easily. I was allowed to play on the playground, but I couldn't participate in organized sports. It was hard to watch my friends go off to their team practices. By the time I was a teen, my heart needed help. My parents took me to the cardiovascular specialist at the Milton S. Hershey Medical Center. Growing up in State College, we all knew about Hershey Medical Center's innovative work on hearts and how they developed the first heart assist pump. Soon it would become a renowned center for heart transplants. I was 15 when I got my first pacemaker. Then I needed a new heart valve. My same surgical team gave me a mechanical one. A few years after that, a severe heart infection took me back to Hershey. I ended up being there for 3 months and hooked up to an ECMO machine, which is a heart-lung bypass machine that gave my body the help it needed to fight the infection. Back then, I think there were only 4 of these machines in the country. The machine and my care team saved my life. My surgeon called me the walking, talking miracle. Over the years, I needed new pacemakers as my heart condition worsened. Eventually, my doctors told me it was time for a new heart. I was 39 with 2 young children. All I wanted was the chance to raise them. The thought of a heart transplant was daunting, but the cardiovascular team at Hershey Medical Center helped me beat the odds many times before. So, 2 decades ago, I put my life in their hands once more, this time for heart transplant surgery. And they gave me my future. My kids will tell you I lead with my heart. I'm eternally grateful that I can.
An amazing story. Joining us right now is Dr. John Boehmer, advanced heart failure and transplant cardiologist at Penn State Health Heart and Vascular. Really an incredible story. At what point do you need to talk to a patient about a heart transplant?
Well, it's not the first thing we talk about. We can manage heart disease for a long time. For example, Doug had heart disease since he was a child, and he was able to grow up, went through a number of things, had a number of conventional things done, like he had a valve replacement done along the way. And eventually, part of his heart muscle just became too weak to keep him going. And at that point, he required help from medicines or mechanical devices in order to support his circulation, to keep his organs functioning and to keep him alive. That's usually the time that we're thinking about heart transplant.
Now, Dr. Boehmer, we've talked to you numerous times over the years on this program. We want to talk about this. Penn State Health Hershey Medical Center celebrates the 40th anniversary of the first heart transplant. That's amazing. Talk to us about this.
My pleasure, and I've been around here for a long time. I went to medical school at Hershey Medical Center at Penn State, and when I was a second-year medical student, the first heart transplant was performed, and I took care of some of the earliest recipients of heart transplant as a medical student, and then came back later and took care of them after I trained in cardiology. And the way we've come along and the program has grown and developed and evolved is really phenomenal. So it means so much to me. We've touched so many lives over those 40 years to give them more life and better life. So it means things to me in terms of real people.
Let's talk about advancement. I know years ago I did a story about a gentleman who was waiting for a heart transplant. He had to push a machine along with him. So many advancements. Where are we at now with the program?
Well, in terms of supporting people with heart pumps, we've come an awful long way. We're one of the pioneers in developing those heart pumps, and in fact, since about 1976, we've been using some of those heart pumps. But the heart pumps now are smaller, they're electric, they're inside the chest. There's still an electric cord that goes from inside the body to outside the body, although we have developed ways at Hershey to get around that. Still not quite in the public domain yet. But in terms of heart transplant, all the drugs have really evolved and changed, and even the way we monitor for rejection. Historically, we'd have to do a procedure to get in the jugular vein, go down to the heart with a pincher device to sample the heart and look for rejection under the microscope. We still do that, but in many cases, we can do a blood test that looks at the gene expression in our immune cells or detects DNA coming out of that heart that the recipient has received from the donor, and find the donor-derived DNA in the bloodstream. And when that goes up, it suggests something's going on with the heart. Then we do a biopsy only when the risk is higher. So we avoid a lot of uncomfortable procedures like heart biopsy. And our patients throughout the nation and internationally are doing better. They're living longer, they're living better, and we're doing better with the drugs and doing better monitoring of the heart.
Oh yeah, absolutely. Now, we are so fortunate to have Penn State College of Medicine right in our backyard. All this research is taking place. I'm sure the research only makes your program stronger.
Yeah, we have a great portfolio of research, both in heart failure to keep people going on with their own heart longer and living better, as well as research after heart transplant. We're involved in studies to better monitor for rejection and things of that sort. And when I was a medical student, we had no proven therapies to treat heart failure back then. Now we have many, and we can keep people living longer and better with their own hearts. But when we need it, we're doing even better with heart transplant.
Now, your team has so many different locations. How does everyone work together to provide the best care for each patient?
Well, the majority of people, as I said, are treated with their own hearts. We don't have that many hearts to go around. Fortunately, most people don't need a heart transplant. We're able to manage them where they are, so making sure that we're all doing the right things and we have quality programs ongoing in all our centers in order to get the right therapy to people at the right time. And after that, if somebody does need advanced therapies, either a heart pump or a heart transplant, we have the ability to get them in quickly, get them evaluated, and get them their needed therapy in a timely fashion.
So much encouraging news. Dr. Boehmer, thank you so much for being with us.
Oh, you're welcome. It's a pleasure.
And if you would like more information, or if you would like to make an appointment with Penn State Health Heart and Vascular, you can call this number 877-467-7484 or visit online at pennstatehealthheart.org. Let's check in with Denise McCracken. Denise, what are some of the questions being asked?
Thanks, Deborah. We have a wide range of questions coming in tonight, and joining us is Aisley Guzman. She is the registered nurse Coordinator of Atrial Fibrillation at Penn State Health Holy Spirit and Hampton Medical Group. Thank you so much for joining us tonight.
Of course. Thank you for having me.
Our first viewer question is, what are the signs and symptoms of a heart attack?
Yeah, so according to the American Heart Association, some of the signs and symptoms of a heart attack can include chest pain or discomfort, lightheadedness, nausea, vomiting, jaw or neck pain, pain in the shoulder or arm, and shortness of breath.
And our next viewer asks, do women have different heart disease symptoms than men?
While the most common symptom we hear about is chest pain, women do tend to have different symptoms than men. They generally have shortness of breath, nausea, vomiting, back, and jaw and abdominal pain.
That's a lot of great information. Thank you so much. And you'll be here until 8 o'clock. And if you at home have a question, you can go to abc27.com/heartchat. Stay with us. We'll be right back.
For some kids, childhood's not carefree. But thanks to 4 Diamonds and the support of Thon, Penn State Health Children's Hospital is tackling childhood cancer. And no 4 Diamonds family will ever get a bill for their child's cancer care. Support the cause at thon.org.
February is Heart Month. Penn State Health Heart and Vascular reminds you to care for your heart with a healthy diet and exercise. Find out your risk of heart disease by taking a simple heart health assessment at pennstatehealthheart.org.
The best teams attract the best talent. That's true on the football field and beyond. As Penn State Health opens new locations across Central PA and delivers superior care at its existing hospitals and clinics, it's looking for talented people from all backgrounds to fill positions throughout the organization. Think you got what it takes to join an exceptional healthcare team? Apply today at pennstatehealth.org/careers.
You're watching Heart to Heart on ABC27, sponsored by Penn State Health.
Welcome back. Joining us is Dr. Safwat Gassis, Medical Director of the Atrial Fibrillation Center at Penn State Health Holy Spirit and Hampton Medical Centers, and Billy Morgan, a patient at Penn State Health. Thank you both for being with us.
It's my pleasure.
Now, Dr. Gassis, we talked a lot about advanced heart issue conditions, but some of these can be prevented. Talk to us about that.
Sure. So in heart conditions, there are different types of factors. There's the modifiable risk factors and the non-modifiable risk factors. Non-modifiable risk factors include the genetics, family history, age. So we focus on the modifiable risk factors. Those include smoking, high blood pressure, diabetes, elevated cholesterol, inactivity, or other conditions that can be treated. So we focus on trying to minimize the future risk of heart disease by focusing on those modifiable risk factors.
Now, Billy, you had some indications of not feeling quite right, and you made an appointment. Talk to us about that.
Yes, I did. About 3 years ago, I got up in the morning and I was just feeling a little off and a little tired, and went out to the table, and all of a sudden I was feeling very lightheaded, almost like I was going to black out. And then I felt my heart racing a little bit, so I got my daughter on the phone right away. And she said, "Do we need to go to the hospital?" And I said, "Well, I don't think so." And she goes, "No, I think you need to get checked out." So I went down to Penn State, and they checked me out thoroughly, EKG and blood pressure and all the tests. And by the time I went through all that, I was feeling pretty good. And they said that I was stable, but to follow up either with my physician or with a cardiologist in the near future. So that's how I ended up at Penn State, and I'm glad I did.
We were talking a little bit earlier, and you had mentioned a family history. Talk to us about your family history.
Yeah, I have quite the family history. My father had his mitral valve replaced, and he had another valve repaired. My mother had rheumatic fever as a child, which gave her heart disease in her later life. She had AFib and heart failure. My sister also had a hole in a heart valve. And then I had a brother at age 60 who had to have triple bypass. And my other brother and myself both have heart murmurs since we were children. But, you know, to this day, knock on wood, you know, everything's good with ours. So
certainly, yes, certainly.
There's a lot.
A
Yes,
lot. You're
a lot.
absolutely right.
Yeah.
Doctor, why is it so important to know your family history?
So obviously we cannot choose our parents and the genetics that comes along with that, but knowing the risk factors that comes along with the conditions that the family has, we can set the stage for what we can do for the future. So knowing that, for example, we may be high risk for a particular heart condition, we can maximize our efforts to be able to reduce that risk in the future. And those can be, for example, things such as coronary artery disease, stroke, vascular problems, heart rhythm issues such as atrial fibrillation. So knowing our family history gives us an advantage to be able to influence and reduce the risk for future problems.
Knowing the family history, but also let's talk about diet. How can we do things to prevent heart disease by eating a heart-healthy diet?
We hear about heart-healthy diets all the time, and those can be variable for many different people. Obviously, everything in moderation is the best, as long as it's got a good balance of carbohydrates, proteins, and the useful fats. Then it should be good. But there are a lot of fad diets out there, and they may work for some people, but they can be tremendously unhealthy and harmful for others. For the most part, we've seen most people do well, for example, with the Mediterranean diet, has a good mixture of things. The best thing to do is to make sure it's monitored so it does not cause secondary problems with the kidney function, with the cholesterol, or a patient's activity-wise or energy level. As long as it's working and it's monitored, that's probably the best diet to follow. But it's important to limit the amount of cholesterol, include healthy fats such as omega-3s, and to balance it that way.
And Billy, talk to us about your heart-healthy diet. What tips can you give our viewers?
Well, I'd say the number one tip is to watch your sodium. And especially when you're at store shopping, read those labels and look and see how much sodium is in there, because any canned goods are most likely not good for you. I eat a lot of fresh fruit, vegetables, frozen vegetables, a lot of turkey, chicken, salmon, tuna, you know, in the fish families, and nuts, also walnuts and almonds. So I try to watch it. Of course, I indulge other times, but as a rule, I think I do pretty well.
Well, you're looking great.
Well, thanks.
So we're talking about diet, but let's talk about things like blood pressure and cholesterol. That also is mixed in with all of this.
Yes, absolutely. So we look at blood pressure, we call that the silent killer, because you may not feel it, but over time that can cause a lot of destruction. So the problem with high blood pressure is that over time it can damage the lining of the blood vessels throughout the body, including the heart, the vessels that lead to the brain, to the kidneys, to the legs. So as they harden as a result of that continued damage, they can form plaques of cholesterol deposits and other inflammatory processes, and that's what causes the blockages. So it can happen silently over a long period of time, and we've seen from many studies that controlling blood pressure reverses those conditions. Similarly with cholesterol, a lot of the plaques that form inside the arteries of those vessels are cholesterol-rich plaques. And by controlling our cholesterol, whether it's through diet or medications or activity, then we can reduce the chances for blockages in various parts of the body.
And Billy, tell to us about how you keep track of all of this with your family doctor.
Yes, well, I have 2 wellness visits a year, which I think are very important. And of course, you know, you get your blood pressure checked, and then I always go through the full, you know, like blood panel, and cholesterol and glucose. And another big thing that I follow up on is vitamin D, because I had an issue with my vitamin D, and as we get older, it just seems like you lose that vitamin D that you really need, and low vitamin D can also, you know, have issues, you know, causing heart disease and also diabetes. So there's so much you really should follow up with your family physician.
Well, thank you, Billy. Thank you for giving us all that information
Sure.
and sharing your journey with us. And Dr. Gassis, I'm going to have you stay here because we'll have some more questions coming up in just a little bit. And if you would like more information, or if you would like to make an appointment with Penn State Health Heart and Vascular, call 877-467-7484 or visit online at pennstatehealthheart.org. Let's check in with Denise and get some answers to more web chat questions.
Thanks, Deborah. Well, joining us is registered nurse Isley Guzman, Atrial Fibrillation Coordinator at Penn State Health Holy Spirit and Hampton Medical Group. We have a few more questions that have come in. This viewer asks, sometimes I can feel my heart speeding up or like a flutter feeling. When do I need to call my doctor?
Yeah, so palpitations are actually pretty common, but we recommend that you reach out to your physician when those palpitations are lasting longer than a few minutes, are increased in frequency, and are associated with lightheadedness, dizziness, shortness of breath, and loss of consciousness.
Our next viewer asks, my doctor has suggested I have a stress test for my heart. Can you tell me what happens during that test?
Yeah, so typically during a exercise stress test, we have you come in, we take your vital signs, we hook you up to electrodes which are hooked up to an EKG monitor. We take your blood pressure, your vital signs every 3 minutes while you're exercising, and then try to get your heart rate up to about 85% of your maximum heart rate, and then have you gradually cool down. For patients who can't exercise, we can give chemical stress test, and that also provides us information about if there's coronary disease.
Our next viewer asks, what can I do to prevent atrial fibrillation?
As with many disease processes, we can, change the modifiable risk factors. So maintaining a healthy weight, maintaining a healthy diet, as Dr. Gassis had mentioned earlier, low in sodium, low in saturated fats, managing our stress, getting good sleep, controlling our high blood pressure, cholesterol, and managing our diabetes.
So that heart-healthy diet seems to be a common theme
tonight.
It is.
It really is.
Tell me a little more about your job position and at what point in the patient's journey are you involved?
Yeah, so I typically see patients in the outpatient setting. Sometimes I see them in the hospital setting. My role is really to provide education and sort of be a patient advocate and liaison for them, provide them education and support, kind of bridge the gap between the outpatient setting and the hospital setting, help to kind of adjust their medicines as they need it with the recommendations of Dr. Gassis.
So it sounds like you're a critical piece in their journey.
Yes.
Well, I'd like to thank you for joining us tonight. You'll be here until 8 o'clock to answer questions from home. You can go to abc27.com/heartchat. Back to you, Deborah.
And thank you, Denise. Back with us is Dr. Gassis, Medical Director of the Atrial Fibrillation Center at Penn State Health, Holy Spirit, and Hampton Medical Centers. Now, you have a remote patient monitoring program now at Penn State Health. Explain that.
Sure. So remote monitoring is becoming more and more prevalent, and the technology is advancing, and we can do that in all sorts of ways and for various conditions. So there's remote monitoring for heart rhythm problems, and there's also remote monitoring for patients with congestive heart failure, which is weakening of the heart muscle. So for congestive heart failure, for example, the patients are monitored and they're at home, and they have equipment to be able to download and give us information in the cardiology offices that reflects the status of their heart failure, and it's able to predict whether they're going to have trouble with heart failure flare-up. And it allows us to be able to intervene and be able to treat those patients earlier before they develop symptoms and require hospitalization.
Now tell me, what patients really best qualify for this program?
So for the heart failure, it's quite basic. If the patient is able to weigh themselves on a regular basis and select down from a menu of symptoms, it's quite straightforward. And at the onset of the program, we get them initiated, where we collect all their information, and they are educated about how to transfer the information to our offices, and that's essentially it. So it's very easy. And in terms of the heart rhythm monitoring, that's automatic. Those are devices, for example, that are implanted or part of their originally implanted devices, like pacemakers and defibrillators. And they automatically collect information continuously and on a daily basis They communicate remotely with another device next to their bed and send that information to our office, so we can monitor their heart rhythms and the status of their heart function, and be able to predict way in advance before they would get into trouble and require hospitalization, so we can proactively intervene.
Sure, and it seems like the benefits of this really are obvious. Staying at home, correct?
Absolutely. So the convenience factor is a big plus, but also it's much less costly to be treated at home than in a hospital setting. But being able to predict a flare-up or an exacerbation of a condition, it prevents a lot of issues down the road. So before, they would require coming into the hospital where their condition is much more dangerous, and there's a lot of morbidity with it. So it saves patients a lot of discomfort and suffering. Also, patients knowing that they're being monitored even in the comfort of their own home, that's it reduces a lot of the anxiety that's associated with their heart condition.
And how long can they be monitored with something like this, and what are the outcomes?
So it depends. So for heart failure, monitoring could be anywhere from a couple of months, especially after a patient leaves the hospital from a flare-up of heart failure, or it can be chronic for up to several years. Patients who are being monitored for their heart rhythm, and they have an implantable device underneath their skin, they can be monitored for decades at a time. Wow. And we can continuously watch their heart rhythm and be able to intervene and be able to deliver the right treatment at the right time and proactively.
Dr. Gassis, thank you so much for all the information tonight.
My pleasure.
You are welcome. And we also want to send a special thanks to Doug and Billy for sharing their stories, and you, our viewers, for sending in your questions. If you would like more information, or if you would like to make an appointment with Penn State Health Heart and Vascular, you can call this number 877-467-7484 or visit online at pennstatehealthheart.org. Thanks for watching tonight. We wish you good health.